The heart of Southeast Asia, Myanmar, known for its golden pagodas and warm smiles, grapples with a series of challenges, including access to affordable dental care. While known as the Golden Land, the country faces a pressing issue with nearly a quarter of the population living below the poverty line. Myanmar is a nation with a population of 51.4 million, 30% residing in urban areas and life expectancy reaching the lowest among ASEAN countries at 64.7 years. Access to dental care is a luxury for many, exacerbating health inequalities. Behind the picturesque landscapes, millions face challenges accessing essential services. Common oral diseases are dental caries and periodontal diseases, following an upward trend in oral cancer. The dentist-to-population ratio in Myanmar is approximately 1 to 16,000, significantly below the WHO recommended 1 to 7,500. The absence of dental therapists and dental hygienists accentuates these disparities.
Hi, my name is Snow. I'm a student at YS. I come from like a family that's like medium to high income in this country. I've been to two different dentists. One is like a smaller clinic, it's a smaller place with like one doctor, and the other one that I've been to is at hospital at RU. There are definitely a lot of differences with the two places. Well, obviously the hospital one costs more and there's a longer wait. At the smaller clinic, it is a lot easier to get a reservation and obviously it's a lot cheaper. But my experience at the small clinic has definitely not been like good. I had a wisdom tooth removal at like the hospital and it went very smoothly compared to like even like a small like filling I've gotten at a small clinic. Smaller clinics, they aren't very good at like reducing your pain levels. Honestly, if they don't find it completely necessary, they won't numb you for situations. I've gotten like semi-root canals without like numbing. And even things like fillings, they can be really not careful. And my experience with those places is that you go and get something done and it's not like a one-off thing. You have to keep going over and over and over again because their work is not good, and like you get a filling, it'll chip off, you have to go back, things like that. And that's how I ended up having to get like a whole tooth implant. It's typically like 1 to 2 lakh for filling, and I was getting it almost like every month or so, like to get the same tooth filled out. And so at some point they were like, oh, why don't you just get a crown? And so I paid like 3 lakh for a crown, and it put me in a lot of pain, and then I just went on with it. And like essentially it's like a hard semi-fake tooth that they put on top of your real tooth. And the thing with teeth is that you want to keep as much of your real one rather than have a fake one, because it's never going to be as strong as your like real tooth. After like 2 weeks after they put in my crown, it completely fell off, and it took like most of my remaining tooth with it. And so now I don't have enough to support like another filling, another crown, things like that. So I'm gonna have to get it all out and get like a whole new tooth transplant. I'm gonna have to get a bone graft for it, wait a couple months for it, and things like that. So definitely it would be an issue for anyone. Like I'm lucky that it was just like lack of research why I went to like a smaller clinic, but I can see how this would be a huge issue for people who can't afford to switch to like a more expensive hospital or don't have the time to recover from like a wisdom tooth removal or something like that. It took me like 3 days to recover. So honestly, I'm really grateful that I have the option. I was just kind of misinformed and undereducated about this, but this is definitely a huge issue for anyone in this country who's trying to improve their life through, dental.
Urgent intervention is crucial to bridge this gap. While it may not be quite an issue in urban areas like Yangon and Mandalay, rural villages, towns, and cities suffer from a lack of access to dentists. Significant concerns arise with high rates of decayed, missing, and filled teeth in young children and high tobacco usage, around 13.6% among students persist. Availability of tobacco from street vendors, lax regulations, and the cheap costs of consumption contribute to high usage rates, with a concerning proportion around 62.9% facing no refusals. The prevalence of premalignant lesions and oral cancer among tobacco users is still linked by 5.4%. It is also a country neglecting oral health in national health plans.
So I'm Dr. Insana. I'm organ Mr. Dentist. I'm graduated from Yangon University. My service is about 24 years. Most of the people in Myanmar, especially in rural areas, they neglect their oral care. They feel very painful, very severe case, they come to dental clinic. And then some of the rural areas, there is no dentist. So dental and population ratio is too different in Myanmar.
စိတ်လေးနဲ့တော့အဆက်တော်သိမရှိဘူး
စိတ်လေးလည်းရှိတာပေါ့နီကိုတင်းကြောင့်လည်းဖြစ်တယ်ခုနနီကိုတင်းကြောင့်လည်းဖြစ်နိုင်တယ်ခုနစာကြောင့်လည်းဒုက္ခပိုးပေါ့နော်ဆေးရွက်ကြီးကြောင့်လည်းဖြစ်နိုင်တယ်အဲ့ဒါတွေကိုသူကသေချာ treatment မယူဘူးဆိုလို့ရှိရင်တော့ then they may change to cancer ဖြစ်သွားနိုင်တာပေါ့
In terms of dentistry education, there are only two providers: Dental Medicine Yangon and the University of Dental Medicine, Mandalay. Hello, my name is Gina and I'm working as an NGO member of Life of the Children. We are currently taking care of 15 children. In my opinion, education and awareness can help bridge the gap in access to dental care among different socioeconomic groups in Myanmar. Prevention education should be carried out as well. You have to teach how to brush your teeth from a young age. Myanmar's government can also take care of people's teeth by implementing agreements with public health centers or autonomous organizations to undergo regular checkups from an early age. Myanmar's government can also take care of people's teeth by implementing agreements with public healthcare centers or autonomous organizations to undergo regular checkups from an early age. Korea offers dental checkups for free up to elementary school students. Even for middle school students, cavity treatment is covered by insurance, so anyone can get treatment in a good environment at an affordable price with the help of the government. That's not enough, and that isn't provided in Myanmar. I think dentistry should have good facilities and medical staff. There are many places where doctors and facilities are underdeveloped, so accurate diagnosis and prevention are not possible. There are many places where doctors and facilities are underdeveloped, so accurate diagnosis and prevention are not possible. This calls for better comprehensive oral health strategies. High prevalence of traumatic dental injuries, untreated caries, and severe periodontitis further underscore the urgent need for action. In a country where oral diseases are largely preventable, immediate measures are imperative to safeguard the well-being of Myanmar's population. Overall, oral health in Myanmar is an alarming yet constantly overlooked issue. To be aware is the first step to advocating for the betterment of overall healthcare in Myanmar.